Hi everyone! This is our Trends and Issues in Healthcare project that we did on nursing staff shortages in acute care settings. This is by Killian Moore and Shonya Stenson. So, it is important to understand a bit of background about this topic and what factors are currently contributing to the nursing shortage. Firstly, it's important to understand that there is not only a shortage of nurses, but additionally, a growing demand for nurses in specialty areas and acute care. Many factors are currently contributing to the nursing shortage in the United States, including some overarching issues such as lack of educators, an increased turnover rate in nurses, and an unequal distribution of workforce. By that meaning across the US having an unequal distribution between surplus and shortage. This presents patient safety issues such as increased errors, such as in medication administration, as well as higher morbidity and mortality rates in the patients. In the United States, the elderly population is growing, contributing to an increased need for nurses. More specifically, the baby boomer generation, who was born from 1946 to 1964, is currently aging. Currently, the US actually has the highest number of Americans over the age of 65 than in any other time in history. In addition, the age of the nursing workforce is increasing. There are currently approximately 1 million RNs over the age of 50, which means that approximately one-third of the workforce could be at retirement age in the next 10 to 15 years. Nurses are retiring, which is contributing to a decrease of nurses available to care for the growing elderly population. The nurse to patient ratio is increasing, leading to decreased quality patient care. Hospital understaffing creates conditions which are dangerous for patients as well as nurses. Insufficient numbers of nursing graduates adversely affect the supply of nurses. So in Michigan, there's actually no law limiting the number of patients a nurse can be assigned, as well as no law limiting the hours a nurse can be mandated to work. This has many implications on not only patient safety, but on nursing satisfaction with their jobs. So, the impact of nursing staff shortage on acute care facilities has been many. Insufficient staffing is raising the stress levels of nurses, which leads to an impact on job satisfaction, a negative impact on job satisfaction, and driving many nurses to leave the profession. High nurse retirement and turnover rates are affecting access to healthcare as there's less nurses available at less skilled levels to perform less jobs. And the need for nurses is expected to increase in outpatient care centers, long term care facilities, and a greater need for home care nurses. However, there are less nurses available to fulfill these needed positions. Continuing on with the impact of the nursing shortage on acute care facilities, according to a study in the Canadian Journal of Nursing, a total of 450 respondents had seriously considered leaving their nursing profession, with 50.4% of these respondents citing that overwork and stress were the primary causes of this feeling. Higher rates of absenteeism were found to be associated with lower job satisfaction, longer shifts, working in acute care, and working full-time. Moderate job dissatisfaction was found to be associated with longer shifts and working in acute care. In light of the current nursing shortage, strategies for reducing absenteeism and increasing job satisfaction are warranted. Patient safety is obviously a huge issue in regards to the nursing care shortage. Identifying and maintaining the appropriate nurse to patient ratio is critical to the delivery of quality patient care. Studies actually reveal an association between higher levels of experienced RN staffing and lower rates of adverse patient outcomes. When healthcare employers fail to recognize the association between RN staffing and patient outcomes, laws and regulations become necessary. This is actually a huge issue across the US. Currently, lots of hospitals have been striking for safe nurse to patient ratios, and it's really something to consider as we enter our future as healthcare professionals. Looking into the future of nursing, a future registered nurse employment is estimated by the National Center for Healthcare Workforce Analysis in 2017, reported that by 2030, the number of registered nurses needed in the United States is estimated to skyrocket by 28.4%, from 2.8 million to 3.6 million. While most states are projected to keep up with demand, there are many places that are expected to have significant shortages in registered nurses. So this is a great infographic explaining the previous slide. According to the National Center for Health Workforce Analysis in a 2017 report, this shows the difference in the supply and demand for a variety of U.S. states. As you can see, some states struggle with shortage while others have a surplus. So, for example, California is expected to have a shortage, and Florida is expected to have a surplus by 53,000, approximately 53,000. Alaska, projected to be short 5,400 RNs, will have the largest percentage of the workforce missing. More than 22% of the needed 23,800 registered nursing positions will be unfulfilled. South Carolina and South Dakota will each be missing about 15%, followed by California and New Jersey lacking about 11% of needed RNs. It is concerning to hear these statistics regarding the nursing shortage, and it makes understanding what is being done to counteract these issues very important. A number of different changes in the staffing models for nursing must be made. One program that was initiated, including the collaboration of perioperative nursing workforce, perioperative nursing leaders at a hospital, and administrations and faculty at a school of nursing. Together, they work to include perioperative experience to student nurses in the BSN program. Through this program, which allotted the opportunity for nursing students to add elective perioperative courses to the curriculum, as well as an adult acute care elective, they had a positive outcome. Some of these positive outcomes included a decreased use of agency nurses at these clinical sites where externships took place, as well as an increased number of younger nurses working in the perioperative areas where they externed. Higher levels of satisfaction reported by nurses in the program helped, as well as the program helped to work against the nursing shortage. The program helped to work against the perioperative nurse shortage at this specific hospital and establish the recruit of new colleagues into the practice. Centralized scheduling is an important component in implementing change. It's an additional measure that can be used to increase nursing satisfaction and counteract the nursing shortage. Centralized scheduling involves pooling nurses from multiple units and scheduling them in one model. Results showed a 34% improvement on the desirability of the nurses' schedules and an approximately 80% reduction of overtime. It also reduced costs by just under 11%. The use of centralized scheduling improves costs and reduced overtime, which therefore increases the satisfaction level for nurses, which can positively impact turnover rates. Looking into the future, it's important as future nurse professionals to consider what we can do and what we will see in the nursing staff shortage in terms of implementing change. Thank you.